Hello, everyone, and welcome to another episode of Tiny Matters with Dr. K, the parenting show about the maybes, the what-ifs, and the everyday conversations we have with ourselves. Now, if you've ever asked yourself the question, why is my child not talking yet? This episode is for you. Today, I'm joined by someone who brings compassion and science to this worry every single day. Keitumetse Kumati is an audiologist who works with children and families and helps them navigate the issues around hearing issues and speech delay. Thank you so much for joining us.
Thanks for having me.
What does an audiologist do?
So I like to think of the ear as having 3 parts, and we assess each part of the ear. So we do hearing assessments, we do vestibular assessments, and so if you have balance issues, that would fall into that. We do hearing aid fittings. That's basically a sum of what we do.
Okay, so everything about the ear, basically.
Everything about the ear.
Okay,
yeah.
All right. So what are the common reasons that parents bring their children to you?
As an audiologist?
As an audiologist.
So as an audiologist, actually, most parents don't bring themselves to my office. There are very few self-referrals. We get a lot of patients in from referrals from doctors, yourselves, pediatricians, ENTs, and it's usually issues with upper respiratory issues. So recurrent sinuses, recurrent tonsillitis, and often those issues can then affect the ear. So that's when we see the kids coming in. The older kids, that's when we might see the self-referrals, but not as often.
Okay, so people generally don't come to you and say, I can't hear, or
not for kids,
struggling to hear.
It's generally adults that will bring themselves in for a hearing assessment.
Okay.
Yeah.
All right. You mentioned that you'd get a lot of referrals from people like myself.
Yeah.
And often when I touch on the hearing issue with parents, they're often quite surprised.
Yeah.
You know, so the average parent will say to me, I know, but my child can hear fine, right? So often when I see speech delays, the first thing I'll ask the parent is your child hearing you?
Yeah.
And a lot of the time the answer is yes, my child's hearing me. I'm perfectly fine.
Yes.
So I don't think people necessarily understand the relationship between hearing and speech.
Yeah.
Can you touch on that a little bit for us?
So I think when you say to a parent that your child might have a hearing issue, they're already thinking that you're saying the child is deaf, right? That there is a complete loss of hearing. They don't understand that there's degrees of hearing loss.
Yeah.
So similarly to your eyes, when you go see an optometrist, you're not going there because you're blind. You're going there because there's a degree of an issue. So the connection between hearing and speech development is a huge one.
Mm-hmm.
And that's why, back in the day, the universities used to make our degree a dual degree, because you can't have speech development without hearing.
Yeah.
A hearing is the input that the brain needs to be able to output the speech.
Yeah.
So without the input, then you can't output.
Yeah.
So kids, they rely on hearing the sounds, the words, the phrases, the sentences repeatedly and consistently, as well as hearing the patterns of speech. So the rhythm, the intonation, you can only learn that through hearing those patterns over and over again.
Yeah, so I think what you said is so important, because parents often do not realize that there's a direct relationship between what my child is hearing and what they're saying.
Yes.
And I think that doesn't just refer to issues with language and hearing, but it refers to stimulation as well.
100%.
You know, how much are we talking to our kids on the daily? Because that is what's going to determine how much their speech is able to develop.
Exactly.
Yeah.
Kids aren't born with a downloaded manual on how to speak. They learn. Speech is not automatic, it's learned. So we need that input on a daily basis for them to be able to develop what they need to communicate.
Yeah. I mean, I think on that note, I don't think anything is more common in terms of a developmental concern for parents than hearing and speech, right? Or not necessarily hearing, but the speech itself. And I think that's determined by so many things. A lot of it is the community parents, right? So the WhatsApp groups, the aunts and everyone else that will tell you your child should be doing this at this age and your child should be doing, and my child was speaking, why is your child not speaking? Or why can your child not hear me? Or, so I think a lot of the concerns and panics and worries that patients have or parents have are kind of determined by society and what's happening. So I want to hear it from a professional. When should parents realistically be worried that there's something wrong with their child's speech or hearing?
Do you know what? I found that the parents that come into my office having some kind of worry are always kind of right. And I find that too many voices can make you confused, but I feel like just listen to your intuition. You know your child the best. And if you feel like there might be something wrong, remove the pressure from yourself and just go consult. You lose nothing by seeing a speech therapist. And have that person be the one that tell you, listen, your child is on par. The errors that they're presenting with are age appropriate. Now you know something. You leave the office knowing something that you didn't know before. Unlike sitting at home and thinking, no, my child is fine, when they aren't. So you lose nothing by just going to consult. Just go consult and have the medical professional be the one that tells you if your child is fine or not. But generally speaking, for speech, my rule of thumb is 1 to 2. You should see your child having one word, I say utterances. So mama, dada. It might not be clear, it might not be, intelligible, but as long as you understand what your child is saying, that's communication. And then 2 to 3, you see 2 words being combined. So mama come, water please. And then 3 to 4 and upwards, you start seeing that multi-word sentences starting to form. That's the general rule of thumb.
Okay. Can we quickly discuss the role of stimulation and screen time in the development of speech?
A big one. One of the things that I ask in my sessions is, what's the family situation like? What's the social context like? If you have a child that's sitting at home with Gogo the whole day, or even a helper, and the helpers just switch them on the TV the whole day, your child is just sitting passively, not learning, not being engaged, and not learning how to effectively communicate. So the children that tend to do better are the ones who are constantly stimulated. And when I say stimulated, I don't mean the screen. I mean like actual real life stimulation interactions. Remember the screen, your child is just sitting in front of a screen passively receiving the content. And these days, the content on the TV is usually high-paced, highly stimulating. The content on the screen is usually fast-paced and highly stimulating. So the kids usually have issues with sustained listening, sustained attention in real life. So the screen can't replace real life conversations. So even with me and you now, we're having a conversation, there's eye contact. There's turn taking. I know when to stop and then you speak, and you know when to stop and I speak. And those things you can only learn in real life. You can't learn it in front of a screen.
And I guess the practicing of speech as well, right? Like you say, they're receiving the speech passively and they don't have to say anything back. So in terms of tonation, in terms of body language, I feel like that's probably affected quite badly as well.
That's a big one as well. The social interaction. I mean, cues, like nonverbal cues, those are the things that you can only learn through interaction. Okay, when this one says a joke, then I need to laugh, or maybe that joke isn't funny, but those are the things that you can only learn in real life. You can't learn that when you're watching Peppa Pig, you know? So also context matters. You're watching a Peppa Pig, which is a UK-based, I think, cartoon. And some of the things they say aren't relevant. The things that we say. So my daughter loves Bluey, and in the car she'll say, "Mom, can you please switch on sat nav?" We don't say sat nav, we say GPS. Exactly. So context is also a big one. And if they're just sitting passively the whole day, just taking in that content, it doesn't benefit them in the real world. Yeah.
I love that. I love that. I mean, I think repeatedly, time and time again, we've spoken about, screen time and how dangerous it is for kids. You know, it's difficult because, we need help with our children. And it is really quite a great parenting aid sometimes. But I think more and more we're seeing the dangers that are associated with at least irresponsible or uncontrolled screen time, especially with regards to speech and language development. So I see a lot of families that come from multicultural, multilingual backgrounds, so we'll have a helper at home that speaks Sesotho, a dad who is Venda, a mom who is Zulu, and a school environment that requires the child to speak English. What do you say to that? Multiple language exposures, are they a pro or a con, and does it delay the child's speech ultimately?
No, it doesn't delay. So, I mean, look at us. We grew up in those households and we were fine. I only learned English in grade 1. And I was able to learn the language and it was absolutely fine. So there's absolutely no issues. And what that affords me now as an adult is that I'm able to have conversations with multiple people who speak different languages outside of my own. And, that's a huge benefit. With the kids that already have a speech delay, I can understand why that might be confusing to people to say, but, my child is struggling with this. I don't want to just add on a lot more demands on my child. So sometimes we'll say, depending obviously on what's causing the delay, is it screen time, let's say, then that might not be necessarily a big issue. So, but like if there's an underlying disorder and your child just generally has difficulty taking in information and processing the information, then we might say, let's look at this maybe 2 languages, and then when they catch up, then we'll add on more languages as they go.
So it can maybe overload them, but only in certain environments.
So it's very dependent on the level of functioning of the child. And I would say that there you would need your speech therapist to do the assessment. But in general, if you're sitting at home and your child is generally fine and there's multiple languages that are being spoken at the home, you don't need to stop them.
All right. I think that's very important, because I've had a lot of parents come to me and say, the school has said to me, we mustn't speak Sesotho at home. We must only speak to the child in English because it's delaying the child and they're not able to follow instructions. I think what you said is so pertinent, that it's so important to expose them to multiple languages.
100%. Your child will catch up. If there are no underlying issues, your child will catch up. And I think it's sad that we have a nation where our kids are just kind of like slowly losing their mother tongue.
Absolutely.
So I disagree with that notion. Kids should be able to speak their mother tongue and they learn English when they need to learn.
Okay. All right. I like that very much. Thank you for that. Okay, so I'm a parent and I have, or Dr. Sebetseba has referred you, referred the child to you. What are the most common reasons that you see children struggle with hearing that are referred to you?
So commonly ear infections.
Okay.
Ear infections are so common, especially with kids that have like your tonsillitis, like I mentioned earlier. They have issues with sinuses. They have poor sleeping. They snore really badly at night. We see that the ears are usually affected as well. And like you mentioned earlier, like the parents, when they come in, they're just like, I don't know why I'm here. The doctor just sent me here. And then I often have to explain, this is what the connection is. And then they're like, oh, okay. And they get even more shocked when they see that the child has indeed a ear infection that is affecting their speech development.
So our understanding of infections is always like, okay, well, your child has an infection, may or may need an antibiotic and some treatment for a couple of days, and then it goes away. But it sounds like you're referring to something that's a little bit more long-standing. I mean, if it's serious or severe enough to cause an issue with hearing and ultimately with speech, then it's quite serious.
100%. Yes. So that's where the chronic or recurrent part comes in.
Okay.
You see kids who've been struggling with tonsillitis for, I don't know, they'll say since birth, you know, since they were born, or for the past 4 years. So that means that this child for the past 4 years has been struggling with this ear infection constantly. And basically what that means is that there's a blockage in the ear.
Yeah.
And when the sound signal passes through or tries to pass through, the brain receives that signal as either distorted or reduced. So the breakdown is happening at the level of the input. So obviously now if that input is affected, then the output will be affected, which is the speech.
So it's like you're saying, almost like a block in the message. So the message is going and then there's something blocking that message from going through to the brain.
So how I like to explain it is that it's like the sound is traveling on a road that's full of potholes. And if you're driving a car on a road that has potholes, by the time you get to a destination, your 2 tires are out, or you know, you have issues with your car. So that's exactly it. Yeah.
Okay. So it sounds like you're referring to glue ear, right?
Yes.
I know I send a lot of kids to you with what we're concerned might be a glue ear.
Yes.
And do you want to elaborate a little bit on what that is?
So a glue ear, so I like to say that there's 3 parts of the ear, and the middle part of the ear is connected to the nose and the throat via a tube that we call the eustachian tube.
Yeah.
So often when you have throat infections, which will be like your tonsillitis, or you have a nose infection like sinusitis, then that infection can travel up into the ear, which then causes the blockage in the ear. Now this blockage has nowhere to go sometimes. Most times it's just sitting in there, it's just stuck. So now the sound signal is trying to pass through and it's not really passing through. A little bit goes through, but eventually the brain receives it as either reduced or distorted. So usually then you will have to see like an ENT, ear, nose, and throat specialist, who will then assist with getting that the blockage removed.
Yeah. Okay. All right. Okay. So it sounds like a lot of the time the treatment would be surgery.
Yes, sometimes it is, especially I think in most cases where it's been a chronic issue, it's been recurrent, the child has been going to see a GP, because you get that a lot. They've been seeing GPs, they've been on antibiotics quite a few times, and we're still seeing like this persisting thing happening. Then yes, most of the time the treatment will be surgery.
You mentioned earlier the snoring as well. Anybody who knows me knows how passionate I am about the snoring child. Because I think that, like you said earlier, we don't actually realize the relationship of the ear, nose, and throat and how that can affect everything, including a child's growth. We've seen so many kids kind of be labeled incorrectly as having autism, for example, or a much more severe diagnosis than something like a glue ear, which is relatively easy to fix if you are able to identify the problem. So, I mean, what would you say? What would you say to parents that are kind of sitting at home with this concern?
Don't rush a diagnosis.
Okay.
If your child is presenting with a speech delay, go see your pediatrician or your speech therapist for the speech delay. They know what to do. They will assess everything they need to assess. And if there's anything that is underlying, that then they will figure that out. So I always say to the parents, don't rush for a diagnosis. If you think your child is autistic, just treat the symptoms first, right? So even when we do refer to doctors who diagnose things like autism, they will like to send you to speech therapy if your child has a speech delay, or occupational therapy if your child needs one. So treat the symptoms, and then we'll get to the diagnosis afterwards.
Yes, you said that, we mustn't be quick to assign a diagnosis to our children.
Yes.
I always say, be the mother, be the father. Someone else is being paid to be the other things, that you don't feel like you're taking on all these burdens for
100%,
yourself, know. But the truth is, speech delay is often a factor, is often a characteristic of a lot of neurodevelopmental conditions, and we often do see speech delay actually all the time. See speech delay as almost a hallmark factor in some neurological conditions like autism. Why do we see that?
So a lot of the developmental disorders, including autism, it affects skills that you need for speech development, right? So it can affect your attention. With speech development, it relies on other skills that can be affected by these developmental disorders. So you need attention to be able to speak. You need listening skills to be able to speak. You need cognition to be able to speak. You need to be able to process the information that's coming in and make sense of what you're hearing. So a lot of these developmental disorders, they affect these skills that are needed for speech development, right? So then speech ends up being something that is affected because of these developmental disorders.
So more than anything, it's a byproduct of the fact that other systems are affected.
Yes. So I'll make an example. So autism is one of the disorders that are quite popular right now. And one of the things that it affects is social interaction, right? So now you need to socialize to be able to develop your speech and language. So now if your social interaction is being affected, you don't know how to do that effectively, then how do you effectively learn how to speak and communicate? Exactly.
Okay. All right. Okay. So, I mean, a lot of these things are multidisciplinary. If in treating a child, I mean, already the patients I've sent to or I sent to are being seen by a pediatrician first, right? And you would generally involve the speech therapist, and you would generally involve the ENT as well. So I think what it points to is the fact that, it really is a multidisciplinary thing. It's hardly ever that my child has a speech delay or a hearing problem and it's just a one-person issue, right? What is the role of early intervention? I think a lot of parents feel like, let me just wait. Let's just wait and just see. It might get better. And then there's parents that react very quickly and it turns out to be nothing. But where do we strike the balance? And what is the role of early intervention in speech?
The earlier the better. I would rather you be wrong that you were too quick than you be wrong that you were too late. You know what I mean? The earlier we get a child, the better, because you have what we call brain plasticity. Meaning that it's easy for the brain to form new pathways and figure out, okay, if this is wrong, let me try and compensate here. But the older a child becomes, the harder it is for the brain to rewire itself. So the earlier the better. For audio, there's actually a 1-3-6 rule, is that we need to screen a child's hearing before the age of 1 month, diagnose them by 3 months, and find a solution for them by 6 months. That early, right? So that should give you a bit of a context as to how quick you should be really bringing in your kids.
And like how urgent.
Urgent it is.
But I mean, I've seen crazy success stories. I've seen children that came in saying nothing and it turned out to be a glue ear. I mean, I spoke about my son earlier who was not saying anything. By the time he was 3, probably had 1 or 2 words and was pointing, if even. And I, in my head, had made up all sorts of diagnoses and had come on to all sorts of conclusions about, what was wrong with him. And it turned out to be a glue ear. And he saw an ENT and had grommets and caught up. And he's perfectly fine. So I agree with you 100%. I cannot advocate that, even more, that the earlier the better.
100%.
Rather worry about a wild child than ignore a child who's actually really struggling.
100%.
What are things parents can do at home in terms of optimizing my child's speech?
Yeah. So I'll start with the screen time because I think it's a big one.
Yeah.
I mean, I'm a working mom myself, and whenever I'm working at home, it's impossible to not have some sort of screen time,
Yeah.
right? So we're not saying that you should be perfect, there shouldn't be any screen time, but what we're saying is that it shouldn't be excessive,
Yeah.
right? And you should be cognizant of what your child is watching.
Yeah.
What kind of content are they taking in?
Yeah.
Right. So try to minimize the screen where you can. So definitely no screen times, maybe at meal times or at bath times. Try to have no screen time.
Yeah.
And then talk to your child as much as possible.
Yeah.
Ask them about their day.
Yeah.
You know, what did you do today? What's your friend's name? You know, do you like the kind of t-shirt you're wearing today? Anything.
Yeah.
What you can also do is model their speech, right? So if your child says, "Mama, ball," then we can say, "Yes, my boy, that's a big blue ball," right? So you're expanding their language. You're
vocabulary.
teaching them how to say longer sentences,
Yeah.
right? And then obviously book reading is a
Yeah.
big one,
Yeah.
a big one. And it doesn't have to be, try to think of a child at their age, right? You're not going to sit and read a book and they need to sit and, listen to the whole thing the entire time. Open the book, look at the pictures, talk about the pictures, because
Yeah.
that's what interests them, right?
Yeah.
What do you think this one is doing? Oh, why do you think this one is crying? Oh, man, that's so sad. What do we say to a baby that's crying? Oh, sorry, baby. That's book reading, right?
Yeah.
It doesn't have to be you sitting and your child listening.
Yeah.
That's boring for
Yeah.
kids. Yeah.
Yeah. Okay. Because you often see they just tear up the book, right?
Yes, exactly. I mean, I would too at that age. That's too much.
Yeah.
Yeah.
Yeah. Okay.
Yeah.
So I like that kind of teaching them to read emotion, read
Yes.
into the
Yes.
picture,
Yes.
chatting around the picture.
Yes.
I always say it's never too early to start reading to a child
100%,
and
yeah.
conversing to a child,
Yes.
just narrating your day and telling
Yes.
them, sure, work was hard today. Obviously with age appropriate language and
Yes.
hopefully no swear words.
Yeah. Hopefully.
Because sometimes so this has been a very insightful conversation
Yeah.
to me.
Yeah.
For me, I think so many parents really, really grapple with, the idea that my child could have a speech problem and actually just don't know where to start.
Yes.
What would you say to parents that are sitting at home with or without any diagnosis and really feel like I should have waited, I should have done this sooner, are struggling with guilt,
Yeah.
Are listening to WhatsApp groups and people around
Yeah.
them telling them there's an issue. Is there anything you would want to say to them?
Remove the pressure. We're all trying. We don't have a manual.
Yeah.
And parenthood is hard.
So hard.
It's really hard.
Yeah.
And you have your own things going on as well. You have your things going on at work. So it's very difficult to have a grapple in everything, right? But the minute you start realizing that there is something going on, it's never too late to do something about it.
Yeah.
And I find that a lot of the parents who feel guilt and all of those emotions, it's more about us and not the kids, right? So make it about your child. Think about your child. If I start therapy today, then in 2 years, they're going to be so much better for it, right? But if I decide that I'm going to start it in 2 years, then you've already delayed them
By
for
2
2
years.
years.
Yeah.
Exactly.
Yeah.
So think about your child and try to get them to reach their best potential. So remove yourself, remove your feelings, try to at least, and make it more about what does my child need?
Yeah. I think for me, the most important thing you've said today is, number one, we're all trying.
Yes.
And number two, trust your gut.
Yes.
I think that comes through time and time and time again when it comes to parenting, when it comes to all things parenting.
Yeah.
But thank you so much for joining us. This really was such an insightful conversation, and I have no doubt it will be super helpful. Today's episode reminds me that finding a diagnosis for your child is not as simple as typing it into a search engine. It often requires holistic support from a multidisciplinary team. It also ties in quite closely to the episode we had with the ENT, Dr. Lumata, where we spoke about snoring and upper airway issues and their contribution to speech, language, and neurological development. Tune into that episode. Thank you for joining us for another episode of Tiny Matters with Dr. K. Until the next time, stay kind and stay curious.